everyone. Welcome to another episode of the VETtalks podcast. My name is Dr. Ludwig, and today I have here with me three lovely students. I'll let them introduce themselves. Today our conversation is going to focus on what veterinarians do, basically beyond the clinic, and we'll look at some myths about the veterinary profession. All right, let me just get straight on it with it. What do you?
Hi, my name is Natalia.
I'm Kira.
And I'm Abdurrahman.
Abdurrahman. Okay. All right. So just like we started this podcast, our previous episode focused on the World Veterinary Day, where we talked about One Health concept. We basically talked about what veterinarians do, focusing on the theme veterinarians' guidance of food and health. Kira was with us in our last episode. Can you give us a recap of what we talked about in the last episode?
So basically we were talking about One Health, how animals, humans and the environment are connected, and the pros and cons of that.
Yeah, pros and cons of how humans and animals are connected here.
Yeah.
All right, Natalia, as a vet student, when you first told someone you were coming to study vet,
Yeah.
what was the reaction? What did you get?
I mean, they were happy for me, mostly my friends and family, they've known that I always wanted to be a vet since I was really young. So when I got accepted and when I started here, they were happy for me. Not a lot of people, I don't think I've ever come across anyone that's wanted to study veterinary. Never, not in school, not through my friend groups, literally no one.
Yeah, I think I also have the same story as you.
Yeah.
Growing up, when I tell people I want to be a vet, they looked at me as if, is that like a real thing?
Yeah, literally.
Up until when I got to the university, I didn't know there was someone like me who also wants to be a veterinarian.
Yeah.
I think it partially had to do with where we grew up, or probably the kind of exposures we had growing up. It kind of was limiting to knowing what specifically veterinarians do. That was how come lots of children didn't really know. How about you, Kira?
Yeah, I think from a young age, my family kind of guessed that I was going to be a vet. So I grew up on a farm, so a lot of my family are in the veterinary field. Not so much vets, but farmers or agriculture, different parts.
And on the farm, what kind of animals did you handle?
Cows. Cows is that's all that's on our farm.
You know, in our part of the world, women don't really do so much with cows.
Yeah.
So when I see ladies who have experience with cows, and I'll be like, ooh, they're strong. I hope you didn't wrestle them. How about you, Abdurrahman?
Well, I always knew it as a kid.
Ooh.
Yeah, like when I was around 6 to 7 years old, I used to ask my mom, if I work as a vet one day, how am I going to fit the elephant in my clinic? Or how am I going to fit the giraffe in my clinic? I always wondered about it. And then she kept always telling me that you won't have to do that. You just go to the field and help it.
Yeah.
So with time and growing up, finally I just ended up here.
So in your past 7 to 8 months that you've been in the vet college, how has the journey been?
Difficult. So difficult.
But
Go.
it's so fun.
Really?
Yeah, I think especially here in the UAE, it's we get experience to like camels,
Yeah.
and even like sheep breed. From the UK, the sheep breed here is completely different.
Yeah.
Like
Even with Spain, like coming from Europe, the cows, the different sizes of cows, like here, they're a little bit smaller. In Europe, they're massive. And same with the sheep and everything.
Abdurrahman, how about you?
I found it quite surprising because I didn't know that we're going to go very far and beyond when it comes to veterinary medicine. I had an assumption just like how normal people have assumptions. That's going to be just typically around small animals, vaccines, but we went way beyond that.
So what has been the assumptions that people have in relation to what you do or what you study or what you are becoming?
Yeah, they mostly think it's just vaccines and just small pets checks, just how like anybody would think that way. But I can assure you it's way more beyond
way
that.
more than that,
Yeah.
of course. Clearly, 7 months have taught you enough to know that veterinary medicine or veterinary practice is way beyond giving rabies vaccines and all.
There's
How
nothing
about
that you expect. I mean, a lot of people think it's easy. A lot of people are like, oh, I mean, it's just animals. Like, it can't be that difficult. And then even my friends, they were like, oh, it's just veterinary medicine. Like, it can't be that hard.
Yeah.
I'm like, it literally has the word medicine in the title. Like, it's difficult, it's complicated, and it's very complex. And then when I started, like, talking to them a bit talking to them about it more, they were like, oh wow, I didn't
Oh,
think
yeah.
that that's what veterinary medicine was like.
I remember when I was in school, we used to have joint classes with the School of Medical Sciences, and then we studied things like biochemistry, physiology, entomology with them. And then they used to look at us like, you guys are just vets. What do you need biochemistry for? What do you need physiology for? And some of them kept, asking ridiculous questions. Like, it's surprising how medics who are in training, say human medics, like people who are studying medicine, most or majority have very little knowledge about what veterinary medicine actually entails, even in training. Kara, what assumptions have you had? Since I'm sure you had friends, you've told them, okay, well, clearly you've had experience with family who are already in animal health. But how about friends who have no clue? What do they assume?
I think the biggest misconception is that vets are like glorified pet sitters.
Oh,
I think people just think that, you bring your dog or your cat to the clinic, you do the general, like, oh, check their teeth, just basic things. Yeah.
so question to all, why do people think that? Why do people think vets only treat pets? Because growing up when I started working professionally, people assume that it's all about cats and dogs. Because I post pictures a lot of me working with horses, working with porcines, working with sheep and goats, and then someone like, I thought you were just for cats and dogs. Even at a point, I used to do a bit of wildlife because I love snakes. And they used to ask me, how is it that one person can do all these? What makes people think that vets are only for cats and dogs?
I think majorly it's the lack of awareness and lack of knowledge about it. Like, for example, when do you ever see a vet on your regular life? It's when you go, for example, you want to just go get your meat, or you want to go, like, for example, for Eid. You want to slaughter your cow or your camel or whatever. That's where you're going to see the vet. He's just inspecting the meat.
Yeah.
Okay. Another example, you have a pet and you have to give him the vaccines. That's your only time seeing a vet.
Yeah.
But you don't see him in the field. You don't see them in the wildlife. You don't see them. For example, when we have like zoonotic diseases,
Yeah.
you don't see them working like that because you
Yeah.
don't see them in your daily life because they're locked in their labs.
Yeah, that's
Yeah.
true.
Okay. What do you think?
Yeah, I mean, you wouldn't see a vet that's treating a tiger in the middle of a forest.
Well, yeah, that's true.
So it's not like you're going to see them anywhere else other than a clinic where they would treat small animals like cats, dogs, bunnies. So usually, and because they're the most common house pets, then that's why people just assume, oh, a vet just means house
Cats
pets.
and dogs.
Exactly. They don't they think that camels and all these other animals just take care of themselves. That there's no vets to give them vaccinations.
That's true. I think all of you would agree with me that social media plays an important role in the information that people need, the awareness that people need. Example, I have a client who has cats and dogs, and then the client calls me, do you know anybody who can treat goats? And I was like, so in my client's mind, she thinks there's a different set of people who treat goats, and there's different
Goat
set
specialists.
of people. Yeah, well, probably there is a goat
Yeah.
specialist, but the information that we need to put out there is the versatility of our profession being cutting across a whole wide range of species. Have you had that realization yet since you came to vet school? Or let me ask the question, what realization have you had about a profession that before you didn't have? That's a tough one, yeah?
I mean, there's a lot of realizations.
Tell me.
Especially, like you said earlier, that everything is more in depth than we expected. And like, I didn't realize how different the anatomy was in each species.
Yeah.
Like, it's so different. Like, some animals will have a specific thing, some animals won't. So that's one main thing that I realized is like, wow, you need to know the anatomy of like every single species because it all varies.
That's true.
Yeah.
Kara?
Yeah, the same as Nak sort of said, you don't realise how in depth you need to go. But also, before I did vet school, I didn't realise that we also have to take things like the data that we do, the statistics that we do.
Yeah.
Like, I thought it would just be like sort of
Animal
biology, biochemistry, not like But it's interesting to learn all these new things.
Yeah. Abdurrahman?
I think my weirdest realization, or like the most random thing I found when I joined the college, is when I realized that everything has to be monitored. Like, if you're gonna have a pet, or you're gonna have a cow, or you're gonna have a cat, any animal you're gonna have, you're gonna have to make sure that it has the perfect temperature of the space that it's in, the temperature of the food that it's eating, and then the bedding that it's sleeping on, and then, because to be honest, okay, this is not an assumption, or like, whenever I go to a farm, I see camels, cows, and goats in the same place, in the same habitat, in the same food. I never realized that, no, there is something specific for each type of animal and each size of animal, and it differs a lot between all kinds of animals.
Yeah.
That's like the most shocking thing I've had.
Well, in this case, you are using the word shocking as compared to a realization. Anyway, so looking at the public misconception about our profession, is this really affecting the profession with the misconceptions they have, the weird assumptions they have? How do you think it's actually affecting the profession?
Yeah, I think like how Kira said, that how people think that vets are just glorified pet sitters. People will bring their animal to the clinic for treatment for something that's pretty severe, and then they'll complain about overcharging or about these things, but it's still a living being, you know, just like how you would take a human to a hospital. Then it's the same thing. So I think these people have in their minds that vets don't really have a serious job. So what you're doing for the animal shouldn't be considered like something expensive, you know?
I actually agree with you on that. From experience, we've had clients who disrespect veterinarians, and we do understand that there's a bit of psychological or emotional stress happening, especially with how people view their pets. We are here to actually help. But then I believe if people knew more about the profession and people didn't have certain misconceptions, like you said, glorified pet sitters, they would speak to us nicely. I can't imagine them speaking to a cardiothoracic surgeon in a hospital the way they would speak to us. Yeah. Not to say that the human doctors are less, less expertise or less important, but we are also as important in our part. We are running different races, and then it's really good to have the respect that we deserve. I believe we've worked so hard in vet school.
You deserve it at that point.
We've worked so hard in vet school to be competent enough to be titled a doctor, to save the pet. So the client should give us that respect. What do you think?
Yeah, no, it's very unlikely.
Have you had any experience like that? I'm sure you've been in a clinic.
Yeah, when I was in Spain, I was working at a veterinary clinic, and the disrespect that you get is just, it's shocking, honestly, because these people, they assume that, like I said, vets just don't have a serious job, and it's just, they just give you a lot of like, hate for no reason. Like you're treating their animal, their loved one, and then they just don't treat you nicely.
Well, anyway, so this conversation about the clientele and the relationship with vets, it's actually a whole different conversation on its own. And I think probably we have to dedicate
another episode.
Yeah, we would need a surgeon here as a guest to tell us the real issue. You guys just started, and I believe you only know up to her, but the real fact, we would have a surgeon as a guest. And so, dear listeners and viewers, please stay tuned in next episodes that are going to follow. We'll have interesting guests that would show up. Now, we've talked about the misconceptions. Let's go into now, what do vets really do? I can count up to like 100. How about you?
Yeah, no, there's a lot. You can't really specialize how human veterinarians, how human doctors can. You can't really specialize like radiologists, the anesthesiologists. You can't really do that. You're all in one, literally.
Yeah.
So I think vets just carry the biggest load.
Yeah, I agree with you. As a veterinarian, back in school, we used to say, as a veterinarian, you are your own nurse, you are your own assistant, you are your own cleaner, you are your own radiology, you are your own phlebotomy, to the point that you are your own Libra.
Yeah.
Yes. So vets who are practicing in general practice usually carry heavy burdens, and it's quite understandable because of how the profession is. But then, surely beyond the pets, there are a lot of things. Now let's tell our viewers and listeners what veterinarians are doing, especially behind the scenes. For example, I can say for meat, I know you were coming to, but let me say for meat inspection, it's something we rarely think about.
Yeah.
We have samosas, we have chicken on a grill, and we have a barbecue and steak, and we enjoy it without thinking, who made sure this
Was safe.
was safe enough? Who made sure this was passed for consumption? And these are some of the behind the scenes that, so like you said, vets that are being glorified, pet sitters. Well, they are the front. They are the vets that we see.
Yeah.
But I'm sure there are like a dozen to maybe scores of things that vets do behind the scene, Abdurrahman.
I think majorly the biggest thing I can think about right now is when we had the pandemic around
Yes.
3 to 4 years ago.
Tell me.
When we all had the COVID pandemic and we all had to stay at home, nobody really thought about vets. Nobody thought what they were doing.
Yeah.
But actually, we played a big role. I mean, vets played a big role
Yeah.
in inspecting the disease and knowing how it passed from the animal to the human and knowing the sources of it, the origins, and how to stop it. Not just the human doctors did a really great part, but we also investigated so much in that. But it all went behind the scenes.
Yeah, behind the scenes. But then also, on that same point, during the COVID, you realized that pet ownership skyrocketed because people were not living homes.
Yeah.
And then there was so many pets, and it created a deficit in the veterinary profession. It was like a bunch, so many pets. People started having, when lockdown was lifted, then they realized, I have pets that technically I don't really need, but I felt like I needed because I was home. And then that makes our profession quite vulnerable because, of course, now there are numbers. How do we solve these problems? That is where now we can start talking about issues of pet abandonment and stray animals. And it's quite sensitive, I know, when I mention
No,
it.
there's just so many.
Yeah, it's quite sensitive. And then that's also a different topic. So once again, these are teasers to our dear listeners who, just for you to understand and know that there are very interesting topics that are going to come your way. We have the trap neuter release. You know that, yeah? Also, vets play key important role in collaboration with the municipalities and then the local governments in so many countries. In the UAE, it's being done as well. So that's just to buttress your point. Kara, what do you think? What do vets do outside the clinic or outside, or let's say behind the scenes?
Yeah, so like Natalia said, you have the vets in the clinic, you have the vets who do food safety. You also have vets that work with the government in like new diseases. You also have vets who are making new antibiotics to make sure that the food that we eat is safe. Yeah, there's just so many.
There's just so many.
There is a lot.
Natalia?
Yeah, like she said, like vaccinations, people that are working in the lab, making sure that the spread of zoonotic diseases are more controlled, rabies vaccines, everything that can harm the public health. That's thanks to the vets. They're the ones that are making sure that the animals can't pass on more diseases.
So in summary, it all boils down to public health, public safety, food security, and then food protection. And as you guys talked, I can't help but feel bad. You forget the vets that taught you to be vets. You forget us in academia. We are also vets, are we not?
Yeah.
Yes. So in academic setting, in research, we make you better vets, don't we? I was hoping that one of you would say it, but none of you. Shame on you guys. Yeah, so veterinarians are also in academic setting, academia, to make the future veterinarians be better vets. So that brings me to our next point. We would have a guest join us in the second part of our conversation. So Dr. Fihad will join us shortly as we wrap up this first half of the conversations. But I really, really enjoy your insights. Now, our listeners who are not do not have any information about what veterinary is about will now know from the horse's mouth. Okay, now let's move on. Practically, I'm sure Natalia has a lot to tell us. Practically, what have you seen in the field? Or before you came to vet school, you've had experiences in the clinic, yeah? So practically, what can you tell us about an experience you had a veterinarian do something that you really got stuck to you, that fueled this passion to pursue the journey?
I think when I was doing everything that I was doing at the clinic, they really gave me an opportunity and a chance to be independent and do things on my own after teaching me. So there were a lot of things that I would kind of take charge in, and that made me feel like, okay, I'm capable of doing this. I'm capable of pursuing my passion, and that just gave me a whole lot of confidence. The surgeon that was working at the clinic with me, you just know he loves to teach, and so he taught me so many things that I really appreciate, because now coming here, I can put it, like when I'm reading the theory, I'm like, I know the practical behind this. And so everything that just, like it makes me feel more confident in myself.
And then how about outside the clinic? What veterinarian or a veterinary situation did you see outside the clinic that was so surprising that I didn't know veterinarians do this?
Oh.
Kira, can you answer that?
Trying to think. Yeah, I think I never realised, which now looking back is really silly, but I didn't realise that vets do all the testing for like TB, so tuberculosis, and then they perform the test, but they also like collect samples, like they collect water samples or like grass samples. I didn't realise vets did that.
Yeah. Abdurrahman, did you have any experience of a vet outside a clinic that shocked you, in your words?
In my own words, something that really shocked me. Many things, actually.
Goodness, tell us.
But I can't think of one like big thing that shocked me. It was only like those small things building up. For example, knowing that vets don't just work in clinics and municipalities, but they also work in the army forces and in the police stations, because they also have animals there. I didn't know that.
You didn't?
No. I thought, okay, like they have animals, yeah. But I didn't know that they have an actual vet just there to check its food, to check its sleep, to check its activity. I didn't really know that.
When starting vet schools, I didn't know there were vets at the airport. Really, I didn't know. I had no idea.
Me neither.
I thought we just take your pets, go to the airport, and then just fly.
Exactly.
I didn't know there was even an entire policy of importation and exportation of pets. I had no idea. Growing up, I thought, okay, I've seen this nice dog, and this Akita, Japanese dog.
Beautiful.
I loved how they looked with that main face. And I told a friend, can you bring me one when coming? And he was like, no, you have to file paperwork and all that. That was where policy came. I was like, okay, so vets are also involved in policy making.
Yeah.
Yeah.
The same thing happened to me when we
It did?
moved from here to Spain for the first time. The amount of paperwork and
Yes.
everything that you have to do, the checkups at the clinic, every single vaccine, everything had to be up to date.
Yes.
It was,
So we see our veterinary work is not all about cats and dogs. And of course, surely we are not glorified pet sitters. In Kira's words, we are not glorified pet sitters. So what challenges do you think vets face, especially with the being under-recognized?
I think the biggest challenges for vets is the public.
Public perception.
Yeah,
yeah.
veterinary, I think.
That's quite controversial here.
It is.
How about the concept of public health? Our conversation has mostly been centered on the cats and dogs and the pets. The conversation is supposed to have been, I think over the past few years, in the past 10 years, there has been a massive improvement in basically all in the UAE. An example is the establishment of this beautiful vet school for the future of this country and the future of the Gulf as well. In fact, the whole world at large. Because veterinarians are in shortage. I'm sure all of you know that we need more veterinarians than we have. Yeah. So looking at it far beyond the clinic, clearly, it's really important that we are properly staffed, properly trained, and then properly resourced. Okay, anything to add up on that before we go to the myths?
No.
Okay, so we have some few myths here. So tell me whether true, false, and they can explain. The first is vets only work in clinic. I'm sure we know the answer to
False.
that. False. And veterinary medicine is easier than human medicine.
False.
Yeah, we're going to say it.
So false.
And then vets don't deal with human health.
False.
Major fault.
Yes.
Super false.
And then finally, vet loves animals, so the job is always enjoyable.
50-50.
Yeah.
50-50.
What do you think?
I mean, when you get a
mean-
cute puppy.
Not when you get kicked.
It's enjoyable, but not always.
Yeah.
Yeah. There are days you lose your patience.
Yeah.
Yeah, that's true.
There are days your patients splash something all over you.
And some days your patients eat you.
Well, well, there are some days I have some bite marks all over from
Yeah.
camels. Yeah.
No.
There are some days you get kicked. There are some days you get stamped. But then there are some days you get kisses from puppies.
Some days.
Yeah.
Days.
That's why
So
it's
it's
50-50.
enjoyable, but they're not always.
Yeah.
Yeah.
But you
That's-
get rammed
that's
by
true.
sheep.
So we've talked about the misconceptions. Sorry, which of them frustrates you the most?
That it's easier than human medicine.
Ah, okay. It's not.
I cannot stand that comment. I really can't stand that comment. I could have a 10-hour debate on that. Like, it is not easier than human medicine.
It's equally as difficult as the human medicine. Clearly, we shouldn't compare which
Exactly.
is easier or not. But then to outrightly state that it's just animals. They are. Well, I don't think
Exactly.
that's the right thing to do.
It's so frustrating.
So, our dear listeners who are listening, veterinary medicine and the path to become a veterinarian is not as easy as you may think. Okay, right from the students who are studying it currently, they will tell you the physiology, biochemistry they have to go through on daily basis to make it through the week. Yeah, Kira, what do you think? Which of the misconceptions really frustrates you?
It's going to have to be the same as Natalia said. It's going to have to be that human medicine is harder.
It's harder.
Because it's such a common one. Everyone just goes like, oh, you're, if you were like, oh yeah, I'm a doctor. Oh, really? Like, what do you specialize in? A veterinarian.
Like,
Yeah.
yeah.
So animal, okay. And they just completely forget everything else you
Yeah,
said.
it's like they invalidate all the hard work you've put
Yeah.
in to become a veterinarian.
Yeah.
I really get that.
And then
It's
they
really
also get
frustrating.
shocked when you tell them, when they ask you, oh, how long do you have to study for?
Yeah.
5 years.
So as we are in this modern world of hyper intelligence, or is this the word super intelligence?
Artificial intelligence.
Artificial intelligence. Basically, it's controlling a lot of things, and there's a fear of our jobs and our professions being taken from us. Personally, I don't agree to that, but some people think their jobs are going to be obsolete in the near future. Thank you very much for joining us, Dr. Fuhad.
Thank
First, let's understand, what is AI?
Well, AI basically, it's like when we ask the machine to look at a huge amount of data, learn from it, and help us make decision based on these data. So it's kind of advisory point for us. That's how it starts, but later on builds up on assisting us in every aspects in our lives.
And how do we relate it to healthcare? I know our listeners will be wondering, are we talking about AI when we've spent over 30 minutes talking about veterinary medicine? How do we connect these to health studies or health medicine to AI?
I believe AI is coming to all aspects of our lives. In veterinary medicine, definitely you can benefit from the AI in analyzing, let's say, lab results, analyzing images, X-rays, and help in taking decisions with diagnosis, with cases, even help you out as your own private assistant that can organize things for you.
Yeah, that's true. Now to you, our students who have the habit of maximizing the use of AI. Well, I'm not snitching on you guys, but yes, AI has become a part. And I am young, but I feel so old sometimes because the kind of things the students do with AI these days. And then, Dr. Fuhad, how are we going to make AI valuable to the study field of medicine?
I mean, the way we do it in the College of Computing, and it's intentional, especially if we work with interdisciplinary sciences like vets and agriculture. What we do is we push students to really use AI, expand the use. So if you think that you use it a lot, this is how we do it. So we push you to use it even more.
Okay.
The idea is to expand their imagination because it's all about what you imagine that AI can help with and test it and see the results. So we start with that, but later on, what we do is that we demolish all of that and we introduce you to hallucinations of AI, fake results and biased data. And then we start building up the trust again from the scratch, which tool is supposed to be used in this situation, how to use it properly, add your guardrails so the responses are valid.
Yes. So from a student's point of view, I'm glad you are here for this conversation. From a student point of view, my concern is the responsible use of AI. Because from experience, I've realized that it's very difficult to differentiate the chaff from the real information that, AI will not tell you, I do not know. They would give you something.
Yeah.
If, example, you use ChatGPT or Grok, and most students I've realized are using that, and it's quite beneficial in a way. But how are students supposed to be using this AI in a very appropriate or a very responsible, the word is responsible manner?
What we do is like we just tell the students these are the right way to deal with AI, to work with AI. There are different AI tools, and not every AI tool is valid for the case you are using it.
Yeah.
First, we need to understand where these fake data, fake responses comes from, and then you can build your prompts. Part of our courses is like prompt engineering. Okay, if you give the right prompt, you will get the right results.
Yeah.
Once you build up your system or your environment where you work with, it will start giving you valid data. And so you have to train it. If you train it to give you, not really straight, then it will respond the same way. But there are specified tools that, that can generate for you prediction.
Yeah.
There are specified tools that only answers the valid answers.
Yeah.
What you feed it in, that's the resource. So we need to tell the student that, you use these tools at these situations. It's not always one tool to use it for all.
Yes. So dear students, you heard?
Yeah.
You were pointing.
Yes.
I had to get back.
Yes. So it's really important to use it appropriately and then responsibly to get. We encourage students to actually use AI. And I think they'll be taking a course on AI in the general courses very soon. So you'll be seeing probably Dr. very soon in your classes. The point is you are supposed to use AI responsibly as you go on this beautiful journey of veterinary medicine. Now, before we end this conversation, let's talk about the mindsets. What mindsets are students supposed to develop for the modern vet, or how is a modern vet going to look like in the near future?
Okay, let me tell you one thing. The AI is not there to replace you. Okay, the AI here is to help you and support you. Your mindset should change from being passive learner, where you're supposed to memorize everything, and then move on to actively engaging AI to help you make decisions. AI is there, and it's going to be part of your job, part of your life, whether you like it or not. So I'm pushing you now to work with it the right way. Just change how you think about AI.
Yeah.
Okay. Can you give us any example of AI you've used?
I mean, honestly, you know how you said that ChatGPT will never say, I don't know.
Yeah.
So sometimes, you'll put in a question and then I already know the answer, for example, but I'm just making sure he knows as well and tells me the same thing. And he'll give me something completely different.
How do you do
For
that?
example, when I was confirming the cranial nerves, I asked him, I was like, tell me the cranial nerves. He gave me 16 cranial nerves when there's not 16 cranial nerves. He gave me 16 and I was like, okay, clearly he's wrong. So a lot of the times I'll have to go on actual official sites like Google Scholar and things like that to confirm the information is correct, because I don't want to get it wrong. I don't want to learn it incorrectly.
Yeah. So that supports the point Dr. made, that we now have to teach AI to be effective for our benefit.
Yeah.
Yes. How about you, Abdurrahman?
I had the same issue, obviously. It always gives me like some random answers, but it depends on your prompt, as he just said. The prompt that you give it will give you the right answer.
Yeah.
So if you want the right answer, you should take your time and think about what you want in the first place, and then explain it to AI exactly how you want it. And then it will give you as close as possible.
Yeah.
But then you also have to double check it, because it's not always right.
Yes. So it all brings us to the idea that AI is beneficial, but it's supposed to be used appropriately. And then you are going to learn how to use this AI and maximize its benefit in your study. Dr. Fuhad, what is the college doing? I've seen some posters.
Yes, actually, it's interesting and something you will participate in.
Yes. So
we have a poster competition, AI poster competition, where students use AI tools, all of it, to create a research poster, and to present their work in any field. And we have students from different disciplinaries, from agriculture, from computer science, even from Islamic Arabic studies, that they use AI. And the part of competition is just, let's see who's the student who benefits the most from AI and how they use it in the best way, even creating their own videos, their own training for materials. I mean, it's just fun, and it's it's where you shine with all your knowledge of AI and your knowledge in your field, how you can put it all together and make something that you compete against everyone from different disciplinaries as well.
So directly from source.
That's
You've
good.
heard all that you need to hear about AI, so I'm sure you pass it on to your colleagues and then tell them they shouldn't panic. I know we funny enough, when you use AI, we can tell you use AI, and it's good, but then responsibly, like we said, and then how it's going to benefit you in the path to become a veterinarian. Dr. Fiha, do you have any pets?
I do have.
Tell us
I
about your pet as
have
we
a
wrap
cat.
up.
Yeah. I have a Bengal cat, and
Okay.
it's naughty cat. Okay, but actually, one of the things that I used AI with my pet, like sometimes there's like doing weird behaviors and just laying down. Hadn't had pets before, so I don't know, to be honest. But then I start taking pictures and provide it to AI and tell me what's going on, even if he's upset and I find some weird, behavior. I started to double check, and to the point where the AI tells me, stop here, go to the vet.
Go to the vet.
Yeah.
I'm really happy you brought that up. So clearly, AI cannot take our jobs.
No, it will enhance it. It will tell you, like, this is simple, you can do it yourself, but when it's serious, it will suggest. And it depends again on the prompt. When you ask the question, ask for a straight answer, no fluff, and it will give you the straight answer.
Okay, all right. So this brings us to the end of the second episode of the Vet Talks. I hope you guys enjoyed the conversation, and I hope our dear listeners also took home great message from this conversation. In our next episode, we are going to have a student, from students' perspective, their journey so far in the vet school. They'll give you some emotional stories. So we will definitely see Natalia back in our next episode, and then we'll get to see how students are going. So for dear prospective students out there who want to pursue veterinary medicine as a career, who would join our Dade College of Veterinary Medicine, I'm entreating you guys to stay tuned for our next episode, episode 3, which is a student's life in College of Veterinary Medicine. Thank you very much, guys. Thank you very much, Doctor, for joining us. I hope we learned a lot from this discussion, and then we'll see you guys soon. This has been the Vet Talks podcast. See you guys.